So I'm going to throw my 2 cents in worth here, and then we're going to call it good. We covered a lot of information here for this last segment. Health insurance is not just an issue about having as many people covered as possible. It is not at all just an issue of who has it and who doesn't. It's an issue of making sure as many people, as large amount of the population is covered as possible. Because if it turns out they have something that's transmittable, they have a disease that can be transmitted to someone else, and they're not seeking medical attention, it's not just about them. And then once they have health insurance, it's us as government officials stepping up to the plate and saying, hey, have we provided training for people on how to use their health insurance coverage? This is not common sense. If you've been used to going to the urgent care or emergency room, you're waiting till you're very sick. This is before health insurance. You know, you've been waiting till you're very sick, so you go to the urgent care emergency room, and now you suddenly have health insurance. It is not common sense. So we need to think about, as municipalities, as government officials, as voters, think about this when we're voting coming up in November. How have they stood against everyone having health insurance? I am not going down party lines here, folks. I'm talking about public health. Who is and is not covered for health coverage affects you, and it affects me. And it affects everyone in my community and my family. So we need to think about those types of things too when we're talking about health insurance coverage. Okay, so know your public health status for your area includes of whether or not people have adequate access to health coverage and medical assistance. Okay, so our public health here, having to do from World War Z, involved how to react to emergencies, see something, say something, campaign, what attracts disease or maintains health, right? And what is public health in your community? What are your weaknesses, your strengths, and what can you do to better improve your odds not to transmit a disease or to contribute to transmitting disease within our community? Okay, so I've really enjoyed doing this segment. I look forward to doing the next one with you guys. This has been a wonderful experience for me. I hope it has been for you too. Don't forget to comment here. What were the things we talked about earlier? Oh, wait a minute. I'm waiting. Okay. I hear one of them. What else? Okay. So we'll go over it again. I think we forgot some of them. So don't forget those 3 points that we covered too, which is testing, right? We talked about human and animal testing, what governs it, and why it's important it evolves. Vaccines. We gave an example of a concern of when children are not vaccinated. We talked about tourism and how it can affect transmission of disease. We talked about diseases we see within the veterinary field. So, and the third one was public health in your area, and we covered it more specifically here with our public health coat of arms. But understanding where weaknesses are, where to get information from, and how we better can contribute to the health and well-being and welfare of our community. So it's been a blessing being here with you. I look forward to us talking in the future, and I hope you guys have a wonderful week. Thank you, and thank you for tuning in to the last installment of World War Z in Public Health.